Each day, a Mid-South infectious disease specialist gives daily briefings and answers questions about coronavirus. Dr. Steve Threlkeld is co-director of Baptist Memorial Hospital's infectious prevention program in Memphis. Here's an update now from today's briefing.
Better ventilation, therefore, is also a very key factor. So if you're outside, presumably that's about as good ventilation as you can get. We have seen cases documented. I guess it was the example from China where a person in a restaurant gave the virus not just to a couple of people at their table, but also in the area where the air conditioning duct was headed. It actually directed the airflow down to another table or two, and some of those people actually got the virus and were infected as well. So you get that out of play if you're outside. So the better the ventilation and the farther you are apart, the naturally better the situation is. We saw it's still somewhat debatable how many cases may have come up at some of the marches and demonstrations. When we first talked about that, I remember saying, well, I'm worried about that. People are too close together. They're yelling. It's much like a football crowd, not ethically linked or any way, but just mechanically to a virus. It's a similar sort of exposure and situation. But I was hoping that the outdoor nature of those might lead to less of an issue with new cases. It seems, at least preliminarily, that was the case. So I think out of doors is just a significantly safer situation. Now, in terms of should we be increasing that at all, it's a tough situation. We've talked many times, and there's obviously a nonstop tension as to the economic realities, the damages, and so forth of shutting everything down versus the medical realities of trying to keep people safe. One would think if you were going to relax anything in terms of businesses, activities that are out of doors, like eating outside, would be one of the safer things that you could do. It needs to be studied to be sure, and it certainly is coming at a time where we're concerned. Cases are generally up, not down. Hospitalizations are up, not down. There are a lot of things about it that are concerning.
And you can watch Dr. Threlkeld's full coronavirus update on our website at WMCActionNews5.com.